The doctor is in. She sure is. She's sitting right here with us. The World Health Organization has now elevated this new variant of interest of COVID, and it is nicknamed Arcturus. So we're not sure of the impact of this yet because it's so new. Questions are coming up, though, about the severity and the need for boosters, among many other concerns.
Yeah, so we have Dr. Abby, Chief Impact Officer for Sharp, and joining us, Sharp Rees-Stealy, right? Joining us this morning to answer our questions about COVID, about how they kind of intertwine with some allergy symptoms. I feel like over the last couple months, there's been a lot of confusion around as allergy season starts to see an uptick, whether it's COVID, whether it's allergies. So thank you for being with us, Dr. Abby, this morning.
Thank you for having me. It's good to see you both.
So, you know, we asked our viewers to send in their COVID-related questions. So one of the first questions, this is an interesting one. A viewer texted us and said, my husband has had COVID 3 times. Note he has a horrible dry cough. Is it related to COVID? Is it allergies? Nothing seems to help.
Yeah, so it potentially is actually related to COVID, and it will actually be possibly long COVID. So unfortunately, the COVID virus can affect all the things that keep our sinus pathways and our lungs clear, and people do see that they have this persistent cough. Sometimes it's a persistent sore throat, but it could also be allergies, especially that postnasal drainage. So when you have postnasal drainage, which is essentially mucus running down the back of your throat, you tend to have this hacking, dry cough. And so I would recommend that he try some allergy medication.
Right.
So Flonase over the counter, something like Claritin, and that's what I would recommend for him.
Okay, to see if it might just be allergies. I mean, that's in the air right now.
Yeah,
we know
I imagine
that.
you kind of have to try both, right? See what it is, kind of test out some antihistamines and that kind of stuff that can help out.
Absolutely, because those things actually do help you if you have a viral infection, if you have a cold, so they're indicated for that. So even if it was from COVID, then that would also help. But he doesn't have an active infection at this point, more than likely. I'm assuming that he's taken a test to rule that out. And so most likely it is from allergies.
So you don't have to be worried about being as contagious, but you'll want to try to at least feel comfortable, I would imagine.
Another question that we have from a viewer is related to kind of variant after variant that we've seen. So it has now been years of us talking about kind of what comes next, how this virus is continuing to morph. So the question that we have is, can you tell us what this new COVID-19 variant is? Some people are reporting, like we said, allergy-like symptoms, itchy, watery eyes. Are those actual symptoms of the new variant?
Absolutely. So what we've seen is that the World Health Organization has actually upgraded this from a variant under monitoring to what is called a variant of interest, and that means that it has mutations that are making it more transmissible. We now have the dominant variant, which is called the Kraken variant. That's what's dominant even here in San Diego. But this new one called Arcturus is possibly more contagious than that, and that is concerning because if it is, then the odds of someone getting exposed to it probably 100%, and a matter of when, not if. So it's important that we protect ourselves against it. We are seeing some reports from India where it was first found in January that it can cause something called pink eye conjunctivitis, especially in children, but that tends to be self-limited. But you can see that it can get confused with allergy season, allergy symptoms. But right now, those are just reports. The main symptoms that we're going to see are the same because it is a sublineage of Omicron. So it's still the same virus, essentially just changed. And it will be cough, sore throat, fever, all the things that we commonly see.
Okay. So right now, so many people have these itchy, watery eyes from the super blooms and all of the things, the pollen's in the air. Do they need to run out and go get COVID tested?
Well, I would say that if you're having it with fever, so that's the big thing that will distinguish an allergy, someone who's having allergy symptoms from a viral infection. So if you're having fever, definitely get a test. If you're having also sore throat and coughing, then it could still be allergies. But if you're having just that conjunctivitis, that pink eye symptom, then more than likely it's just mainly from allergies. But it's never a bad idea to get a test.
Okay. We only have about a minute here, but the booster shots, who can get one right now? Does it protect us against some of these latest variants?
Absolutely. So we will still expect that the vaccinations will protect, which is really good. So make sure that you have updated your vaccine schedule. If you haven't had a booster, the bivalent booster, make sure that you get one. And remember that the CDC just approved this for people that are 65 and older and people that are immunocompromised, they approved an additional one.
Okay.
So make sure that you update your vaccinations.
And will this be a yearly type of booster that we need?
Yeah, more than likely.
Okay.
Yes. COVID is here to stay.
Right.
And so you should just remember to get your flu shot, and so that's important too.
Dr. Abby, thank you as always
Yes.
for answering our questions and for being a part of our segment here. The doctor's
The first
in.
day of the doctor is in.
Exactly, inaugural
Yes, thank
round
you.
of it. We appreciate it.
Thank you.